Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, a crisis within a crisis. The coronavirus pandemic risks crippling food access for hundreds of millions of people across Africa. Efforts to contain the spread of COVID-19 may exacerbate food insecurity that was already gripping parts of the continent, even before the health emergency. Also, the UN warns that Saudi Arabia's mass deportations of Ethiopians could lead to the spread of infection as hundreds of people are crammed into quarantine centres. It's thought thousands have been sent back this month alone. And the coronavirus pandemic has had a huge impact on religious gatherings across the continent. But in Mali, many of the faithful continue to risk coming together to worship at mosque. Our correspondents tell us more. But first, from a shortage of field workers to disrupted supply lines and the effects of measures to restrict movement, the coronavirus crisis could cause food shortages around the world. The risks are particularly serious across Africa, where over 100 million people have been experiencing increasing food insecurity over the last few years. Now, there are fears that the effects of the fight back against the spread of COVID-19 will hit vulnerable communities on the continent particularly hard. Earlier, I spoke to the Food and Agricultural Organization's Director of Emergency and Resilience Division to ask how the pandemic has affected access to food across Africa.
Prior to the crisis, globally in the world, there were already over 113 million people in acute food insecurity. So this is the type of food insecurity where people have to cut the number of meals, the quality of the meals. Sometimes they have even to sell their belongings to cover their food requirements, and they need humanitarian assistance. The bulk of these people are in Africa, in different parts of Africa. Coronavirus is clearly putting an extra source of vulnerability, an extra shock, and therefore we are very concerned that this situation and both the health impact as well as the impact of some of the very important containment measures that have to be taken in terms of circulation of food, supply of food, may further exacerbate the situation, and that at the end of the day, we may end up with, for these countries in particular, a crisis within the crisis, a food security crisis within the health crisis. And this is why it is very important to take measures very early on.
Now, we've already seen some incidents of unrest in particularly vulnerable communities struggling to get enough to eat, specifically Kenya and South Africa. So what can be done about the immediate concerns about access to food for communities like this who are under lockdown, particularly those living in cities?
Yeah, exactly. I mean, there are a number of issues, as you very rightly say. I mean, when it comes to food, there is the issue of the production of food that is taking place in rural area. We need to make sure it continues and that it flows to the city. But then when it reaches the city, I mean, where, of course, in many countries there is a lot of informal economy, we need to make sure that people have access to food so that they have enough cash to access that food. And this is why one of the recommendations we are putting forward in our interaction with the government, with whom we are working very closely, is to actually beef up social protection systems by simply including more people under these social protection systems and make sure that there are extra benefits that are being paid so that people can continue to safely access food.
And what else would the FAO recommend in terms of longer-term precautions or steps that can be taken to address the food crisis on the continent?
Working with the government, but also the regional organizations and sub-regional organizations to strengthen the monitoring of the situation, the understanding of the situation, so as to make sure that we take the right policy measures, including, for example, social protection, but also how do we make sure that we continue in terms of the supply of agricultural inputs, that we ensure the flow of food from the production area to the consumption area, for example, by promoting the concept of food corridors. I mean, all these are measures that can mitigate the various impacts of the coronavirus.
Now, the challenges facing, let's say, DR Congo would be very different from those faced by countries in the Sahel. Tell us a bit more about some of the regional differences across the continent in terms of what strategic priorities should be in trying to tackle food security.
So when it comes to food security on the continent, and especially acute food insecurity, there are a number of hotspots like the Horn of Africa that is currently exposed to also the threat of the desert locust, where there is high level of vulnerability. There is, as you say, the Sahel, the Congo, the Sahel, for example. There is a lot of food insecurity that is already related to insecurity, to conflict, for example, in the Lake Chad, in the Liptako-Gourma area, which is Burkina, Niger, and Mali area related to armed group activities. I mean, for these countries, I think it's absolutely important, for example, that we be able to catch the next planting season that is coming soon in the Sahel, that will start as of May, June, and that we make sure that there is enough agricultural inputs that reach the rural area, and that there is enough labor force to make sure that enough field is planted so as to generate an harvest. This is absolutely critical, and this is part of the interaction we are having with the regional institutions as well.
Dominique Berger speaking to me there a little earlier on. Now, as mentioned earlier, poorer urban communities under lockdown are struggling to get enough to eat. In Kenya, the government's trying hard to strike a balance between managing public health and public hunger and is finding it difficult going.
Residents crowd the streets as shops remain open for business. It's the best compromise that the Kenyan government could find, but enforcing social distancing remains a challenge.
If you impose a lockdown, for example, in the country as at now, and in an informal settlement, and people don't change their behavior, they don't comprehend the essence and the significance of trying to take the precautionary measures. Even if you impose a lockdown and they don't observe the necessary precautions, there is nothing you have done. So to me, the most important thing is people changing their behavior.
Kenya has so far imposed a nighttime curfew, but President Kenyatta has hinted at a full lockdown to force people to comply. But in a city such as Nairobi, where over half of residents live in overcrowded slums, there are bigger fears than the coronavirus. Scenes of chaos erupted as crowds scrambled for food aid last week. Since the measures, many relying on informal work are struggling to feed their families.
Na wakiweka lockdown aje tutakuwa tunakula aje? Sasa hiyo tutaamua heri tukufe corona tutoke nje tusikufe njaa ndani ya nyumba.
They can't risk the people of the slum, in this slum particularly, going hungry and then violence ensuing in the surrounding neighborhoods.
Mass testing could allow for softer measures, but most countries on the continent remain ill-equipped to carry out large-scale tests.
Saudi Arabia has ramped up the deportation of Ethiopian migrants. According to the International Organization for Migration, nearly 3,000 workers living in the kingdom have been flown back to Addis Ababa over the last couple of weeks. Maria Gerth-Niculescu tells us more.
Upon arrival, migrants returning from Saudi Arabia were taken to mandatory quarantine facilities in Addis Ababa, but the number of centers is limited and the UN warns that future overcrowding might accelerate the spread of the coronavirus in the country.
If the rate of return continues, we will run out of quarantine facilities. There is space for now, but there is only so much space, especially given the importance of ensuring physical distancing between migrants.
Thousands of Ethiopian migrant workers are living in Saudi Arabia. Many of them are employed as domestic workers. But in 2017, the Saudi kingdom launched a campaign to remove undocumented migrants from its territory. Ever since, about 10,000 people, including children, were returned to Ethiopia every month. Now authorities in Saudi Arabia deny forcing anyone to return during the coronavirus crisis. They say they are organizing repatriation with the consent of the countries of origin. Now the UN is calling for a temporary ban on repatriation as the Ethiopian government simply does not have the capacity to properly cope with returning migrants in a time where coronavirus is requiring scaled-up efforts and means. According to the Ethiopian Public Health Institute, all migrants will be tested for COVID-19, but this might be a challenging task since the country still has a very limited number of tests available.
Well, the coronavirus pandemic's had a huge impact on religious gatherings across the continent. Many believers of all religions have found themselves having to choose between their faith and the health of their communities. But in Mali, many of the faithful continue to risk coming together to worship at mosque. Our correspondent sent us this report.
Verses from the Quran piously recited by faithful worshippers, side by side without any safety distance. It's an everyday scene in this Bamako street during one of 5 daily prayers. Despite the risk of the spread of coronavirus, these religious gatherings have not been prohibited in Mali, to the great satisfaction of these believers.
Si on nous enlève la possibilité de prier, c'est comme on nous empêchait un peu de faire de ce que nous voulons.
Around this mosque, the crowd gathers for the main Friday prayer. The regular hygiene ritual for ablutions, and only a few masks can be seen among those who came to listen to the Imam, who's been leading prayers for around 40 years. The influential Imam, Mahmoud Diko. There are more than 100 faithful followers every week. So far, mosques have not been banned from assembling more than 50 people, a measure, according to the Imam, that is difficult to apply in a country that is 94% Muslim.
It's not a good idea to ask people who aren't used to staying at home to suddenly do so. The virus is a reality, but we have to wait for the authorities to say something about this.
Discussions are said to have taken place between authorities and religious communities, but there's still no clear-cut decision on mosques. The lack of social distancing, also visible in the streets and markets of Bamako, worries Dr. Musa Sanogo. This public health specialist no longer leaves his office and warns against the continuation of these public gatherings.
The fact that people get together creates the possibility, but also the conditions for contagion to happen and become a mass contagion. A pandemic or such an epidemic is not just the sole responsibility of health professionals, it is a collective responsibility.
A warning that is all the more necessary, according to health professionals, as the number of COVID-19 cases has more than doubled in less than a week.
Well, that's it for Eye on Africa for now. Thanks very much for joining us. Do so again. Take care.